join me in pledge allegiance to our flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. All right, again, we're honored today to have a presentation by our Clermont County Board of Health and Julianne Nesbitt, our Health Commissioner. Welcome.
Thank you. Okay, so I wanted to come down today and talk to you about some good things we've been doing at Clermont County Public Health. We have a couple new programs and some other things that we're just wanting to highlight. First thing I'm going to start off with is we applied for some grant funding this year to be able to provide free bike helmets to children. It was something new that we did. We ran across some grant funding that actually came out of the Ohio Academy of Pediatrics. They're actually working on trying to put legislation through to make bike helmets mandatory up to the age of 16 for when children are riding bikes. To do that, so they give away free bike helmets. We actually combined this with the Eastside Adventure Challenge, and we did the family fun adventure piece of that, which was just kind of a free, not quite as intense, not quite as muddy version of the Eastside Adventure Challenge. So we had about 410 participants register for that piece of it. But with the bike helmets, we were a huge success. We hope to be able to do this again next year if the grant funding is available, and we will have to beef up staffing. I had 4 staff fitting children for bike helmets, and there was a line all the way across the parking lot. So we gave away 75 helmets. It was actually nice because my staff literally fit the kids, gave them instruction. We had a little game where they could break eggs. Inside there was one little head with a helmet and one without, and they can drop them, and it simulates them wearing a helmet. So went over really well with it. We gave away 75 of our helmets. We have about 25 left. What we found out though is the larger helmets, which are meant for those older teenagers, it's really not cool to really wear a bike helmet at that age. So we have quite a few of those left. We are actually going to try to get rid of those during our walk-in immunization clinic here coming up at the September 1st to be able to do that, because we'll hit that kind of junior high school group with some back-to-school vaccinations and hope to be able to
watch the Tour de France and say they're all wearing
helmets. They are. So, but we also did a survey with the kiddos that we gave helmets to. Only 39% of those say that they always wear a helmet when they're riding a bike, and we were mainly hitting those littler ones, which is concerning to us. 25% say sometimes they do, and 36% we say we never do. So I think that was a really good kind of issue that we took on, and we're able to do some good with that. So next thing is we are really starting to push our tobacco cessation program this year. So last year I had one of my nurses, Denise Frainer. She is a certified tobacco treatment specialist. She actually went to the training to be able to do that. It is expensive training. However, we were fortunate enough to get a scholarship through the Ohio Department of Health to send somebody here locally to be able to get that certification to do it. And so we're really ramping up services with that. Denise does one-on-one counseling with individuals. She will also help them. She'll work with their primary care physician if they need some type of tobacco replacement therapy. Some of those can be by prescription, some of them are over the counter, but whatever works best for the person. Obviously, smoking is still, and tobacco use in general, all tobacco use is one of our biggest concerns. It's one of our main issues in our community health improvement plan that we're working on. According to the CDC, it is still the leading preventable cause of death in the U.S. So that, it particularly is concern. Smoking actually causes more deaths each year than if you combine HIV, illegal drug use, alcohol use, motor vehicle, and fire harm related incidents. Tobacco is still the #1 killer. And that's kind of the gamut of everything that it can cause, from, cancers and other types of illnesses with it. So just another little quick statistic up there that quitting smoking before the age of 40 reduces your risk of dying from smoke-related diseases by about 90%. As soon as somebody stops using tobacco products, they see a significant increase in their health status. So really, at any age and at any time, it's a good thing. Denise currently does those trainings. There is no out-of-pocket cost to any resident in Clermont County. They can contact us at our nursing division. I'll have a number up here in a bit. and schedule those directly with her. The first session, she does like to meet with people one-on-one. However, after that, we have a couple different ways that we can counsel people, because one-on-one sessions don't always work for everybody. We have busy people. She can do email, because we have encrypted email, because there are some HIPAA concerns with that. So we can do it by email, and then she can do it by phone also after that first initial session where they kind of meet. So there's options for people who are out there.
Julianne, before you move on that, I know that you and Tom have been talking. Are you at some point you might be able to brief the board on what we're looking at doing?
Yes.
The healthcare?
Yes. Do you want me to talk?
Please.
Go. Okay. So yes, we are looking at working with the county employees this coming year. We're actually going to try to start something in the fall. Denise will take on anybody currently. So if there is any county employees, she's willing to take them on now. We're actually going to try to work to see what we can do to tie it in with some of the health benefits to be able to offer tobacco cessation classes to any of the county employees. We have kind of schedules set up for next year that we can work on doing some larger group sessions for that first meeting, and then individual counseling sessions for there. The Healthcare Advisory Committee is meeting to try to figure out how that may work and what it may end up impacting with the healthcare benefits.
You know, a lot of people are going to these e-cigarettes thinking it's better for them, but it's really not, though, is it?
So at this point, I don't think there's enough research out there yet on the e-cigarettes. The other thing is e-cigarettes have, up until recently, have been completely unregulated. So the FDA actually put into regulation where they will now start regulating e-cigarettes. So I think you're going to see probably over the next couple years some significant changes with those where they're going to become more regulated like any other tobacco product. The sad part is currently a lot of those e-cigarette manufacturers, they target them to children. They make bubblegum flavored, the vapor that they put in there, the liquid that they put in there to use. Most adults don't need bubblegum flavored nicotine products. So I think you're going to see a lot of regulation by the FDA coming down, looking at those, and we'll kind of wait and see how that impacts things over the next year or two. There is some discussion about if somebody is a tobacco user, moving to that as some type of tobacco replacement therapy. And again, I just don't think there is good enough research out there at this point to state if that's any better for you or not. I think there's some concerns about the chemicals that in there. Again, the levels of nicotine is completely unregulated currently. So it could be much, much worse for you. We just don't have a lot of that research and regulation controls in place, but I think we're going to see it come. The Ohio Buckles Buckeyes program. So this program has been in Clermont County before. It's been traditionally ran out of one of the fire departments where they can give car seats to low-income individuals. Unfortunately, the problem with the fire department's not that they haven't done a fabulous job with it, but I think sometimes it's hard to implement where you have people who do shift work and they work 24 on and so many hours off, and being able to staff it because you have to have certified individuals who can install the car seats. The training to install a car seat is 5 days long, just to be able to install a car seat. So I had, a Children's Hospital had actually approached us about becoming the distribution site for Clermont County, and we agreed to do that. So they did give us a scholarship for the training. Unfortunately, we get no funding for our staff, but they do give us the car seats for free. I have one of my nurses, Jan Napier, and then one of my WIC clerks, Karen Smith, who went to the 5-day training and got certified and to be able to do everything to do it. So here in the next couple weeks, we're going to kind of ramp up that distribution. We get car seats that will fit an infant up to 5 pounds, and then all the way through the gamut of the full, I think it's 80 pounds now. The main one is like a convertible one. We don't give away the really cute pumpkin carriers because those are super expensive with it, but there is a convertible one that'll go anywhere from 5 pounds to a rear facing to forward facing to a booster seat. And then we do also give booster seats in case we have older kids who just need the booster seat at that point. I think it'll work out really well because it's going to be done out of our nursing division with that, which is in the Family Support Services building with DJFS. So you got Children Protective Services over there. We have our WIC program running out of there. our immunization clinic. So I think it'll be a good thing to have it over there. We'll be able to really deal with families anytime during our office hours. They can come in because they do have to watch a short little video. And then they actually, my staff have to go out and put the car seat in their car and then take it out and make the parent put the car seat in the car to show that they can take it in and out of the car. So it does take a little bit of time, but it's a really nice option for families that will be able to do that.
Julianne, I thought you were going to tell us that there's a special car seat for convertibles.
For,
I was kind of thinking about that.
I don't think there's a special one, but you would be amazed at the different types, which is why the training's 5 days long to become certified, of the different types of car seats. And then the bigger issue is the different car manufacturers all have different directions on how you install a car seat into their vehicle.
So this is a federal program.
So it is a federal program, yes, but the staff have to be able to read the car seat instructions and the vehicle instructions and figure out how it all goes together. So it's actually more difficult than what you would think to be
Well, it's
able to
also
just.
the age of the car too.
True.
Because nowadays, of course, I'm experienced at this part now. Nowadays, they have that little.
You got the clips. You got the clips in there. Yeah.
Which makes it nice, but the older cars don't have that.
No. So yeah, they have to be able to do the different versions, different ways.
So the fire departments complement what you're doing now, though, but they still
Some of
do it.
They actually don't do where they'll give away the free car seats
No,
because
as
the
far
program
as
does.
installing them, sorry.
Yes, some of them still have certified instructors who can install or check. So some families actually have car seats. They just don't know if they've been installed properly. Some of the fire departments can still check that on it. My staff can do it too if they're available. If we have a family who comes in and says, I got the car seat, I just don't know that it's in the car right. We can go down and check.
So we've
it
had
for
the
'em.
fire department install ours.
Yeah.
A question too, this is a personal thing though. Rear facing, when do you start the rear facing? I know they say up to 2, keep them rear facing.
Mm-hmm.
Don't do front facing until after 2. Is that still the same?
I believe it is. It changes quite frequently, though, on what recommendations are on it. So you can, like American Academy of Pediatrics would have recommendations on there for it. Sometimes that's difficult, though, depending on the size of the child. And so it's hard to meet. A lot of them will have weight and age requirements, because if you have a really large child, to keep them rear facing to 2 is like they're scrunched in there to be able to do that. So
So Commissioner Pratt, how many questions would you have had 4 years ago?
None of these.
When you were giving a presentation, you wouldn't have said one.
Yeah, none
things
none
about
of
car
these.
seats. I was amazed that they have to go through 5 days of training to get certified. I mean, I was thinking like 1 or 2. You got to go through something, but no, 5 days of training. I mean, 8 hours a day. And then the last day, I think, is like demonstration installs in the morning and then testing certification in the afternoon. So it's pretty intense to be able to
One of the
install a car
problems with
seat.
fire departments is we have so many throughout the county, and so their ability to provide an instructor and
Yes.
do all the pieces is pretty.
It's difficult for them. They've done a wonderful job. It's just,
Yep.
I have 2, and I made sure my staff are full-time staff, so they can
Right.
accommodate us. We also run, our WIC clinic runs like late evening hours, so we can work on if we need to get somebody after hours or something, we'll accommodate them.
I appreciate the fire departments doing this, but it's better to be
So,
focused in your group.
So I'm not going to spend a whole lot of time here. So we still continue to work with emerging issues that come up all the time. And this is normally what keeps us busy and hopping. I think a lot of people don't think about Ebola anymore because it's kind of come and gone. What they don't realize is we are still doing increased training with our staff with it. Actually, we have a regional exercise coming up this Wednesday with public health and other partner agencies that we're doing, still looking at Ebola response, because that, again, can rear up and come back at any time with it. Obviously, the harmful algal blooms we've been dealing with. Last year, we were dealing with it in the Ohio River. This year, we're back. It's back at East Fork. So we've been putting out information, trying to educate the public on what they can and shouldn't do, and just giving them recommendations so they can make some informed decisions on their own. And then Zika. Zika is probably the hot topic right now for everybody wanting to know what's going on with it. Of particular concern, it's because it causes microencephaly in children, so that's where a baby can be born with a reduced cranium skull size. with it, and then obviously has some impacts on that child.
Is there any
With it.
vaccinations against that?
Currently, no. There aren't. However, I think people have to keep in mind right now it is not transmitting directly in the United States. So it is still your kind of Caribbean area where if you're traveling outside the country and you're going, is where you can actually get it. So not to say that there hasn't been transmission, but it's not in the mosquito population in the United States that they have found yet with that. So what happens is a lot of people are traveling to areas that are impacted by Zika. They're, not wearing bug spray or trying to prevent those mosquito bites. They're getting bit there. They come back with it. They either contract it from the mosquito bite, or we have had transmission sexually from one partner to another partner once the person has returned back to the United States.
Case of that in Ohio.
In Ohio, we did. We had our first case that came up where, again, I believe a husband had traveled on business somewhere and had come back into the country. So it does occur. So we are giving out recommendations on that, particularly where we focus is we do international travel vaccines. So we try to focus in those clinics because we know those people are heading overseas. We've worked with the physicians in the area, again, making them aware of what's going on. If they have people who are return travelers, what they're considered doing, there's recommendations. There's recommendations in particular for people who are trying to conceive. About what they should do, if they should use other forms of protection, how long they want to wait, what they want to do with that. The other piece of it is I'm actually meeting with a representative from the Ohio Department of Health later on today. They're going to do some increased mosquito monitoring in Clermont County. They received some funding to be able to do that. Unfortunately, I just I don't have the staff capacity to be able to do it this summer. But they're going to come down. The difference, though, between West Nile and Zika, which are both mosquito-borne. So West Nile, what happens is it goes from the mosquito population in the early spring to the bird population and then to the human population. So a lot of times we test the mosquito population and they actually test them for the virus because approximately 4 to 6 weeks later we're going to see it in the human population. West Nile is pretty much endemic in the United States now, but they still do that monitoring to kind of know when it's going to hit during the summer months. Zika is a little different. Zika, the mosquito, is just the intermediary, so it has to bite one person who is infected with it and then go bite another person to be able to transmit the virus. So there's no other host in there. It's literally kind of human to human. So they will be monitoring for the types of mosquitoes. There are also different species that carry West Nile than what carry Zika. It's not the same species of mosquito. They'll be monitoring those, but really for Zika, they're just going to be identifying the species to know if the mosquito is present. They will not be testing it for the actual Zika virus.
Actually, if you have standing water, what would you recommend?
So standing water, these are the type of mosquitoes that we call them like the container mosquitoes. So, tires, buckets, bird baths, kiddie pools, anything that's going to hold water on it, you basically want to be dumping it. You got about a 7-day cycle. You want to be dumping that water out, making sure that you're washing it out a little bit and cleaning it. That's so basically the mosquito can't land, lay the eggs, hatch out the larvae to be able to have additional mosquitoes. So the difference in the two types, West Nile type of mosquitoes, they typically will lay their eggs in like a center of standing water. The species of mosquito that carries Zika actually lays it on the sidewall of a container right above the water line, and they wait for the water line to come up to flood or to get additional rainwater to come up, and then the eggs will hatch out to the larva from there. So a little bit different, but still container mosquitoes. So really dump the water, clean them out, don't let standing water. If you've got low-lying areas where it's water all the time, there are products you can go buy at most, hardware stores, so Lowe's, Home Depot. You can go get the little mosquito dunks, which are a larvicide that you can just toss them in there, relatively safe product that they can take to treat mosquitoes on their own property. All right, any other questions on that one? Prevent blindness. This is not a new program, but this is a program that doesn't really get a lot of publicity from us. So we have done this program for years, and it's actually It's throughout the kind of entire state, but what we end up doing is assisting residents in getting free eye exams or glasses with it. So, again, some little facts up there. 200,000 Ohioans are blind or visually impaired. 16% of Ohioans are at risk for losing their sight without early detection. I think they have a general, I can't remember what the statistics is, but a very large number of people can prevent going blind if there's early detection of what's going on. So Linda Foltz is our clerk that runs this program. She works with typically about 100 residents annually. They can simply call her. She will work at trying to find them a provider that will give them an eye exam, and then if they cannot afford glasses, she will also work to find a place. We have a few places, Lions Club is very good about doing it, that can get people free glasses. So very important program that we do. A lot of people aren't aware of it though, and we try to publicize it a couple times a year so we get people calling in, but particularly if there's anybody in the community who's having issues with it, please have them call us and we'll work with them to get them an exam and get them glasses if they need it.
But no, even with the Lions Club, if you have your old glasses, you can donate them.
You can donate them to them, yes, which is a great program. So we have decided to bring medical gas permits and inspections to Clermont County. So in the past, we have either contracted with the state of Ohio, and then for the last several years, we've contracted with Hamilton County Public Health to do this service for us. The biggest issue is I didn't have staff certified to be able to do it. It also does cost us insurance, and you have to have a higher level of insurance to be able to do this type of inspection with it. But we decided to kind of bring that back into our shop, which is great for kind of economic development in the county, because instead of having to come and get your building and your plumbing permits and all that, you still had to go get medical gas over in Hamilton County. They can come and get that directly from us now. 2 staff members, Kevin Jester and Kelly Shepard, kind of spent January, February, March, part of April going through. It's a web-based online program, but it's really pretty intense to be able to be certified to do medical gas permitting and inspections. They both became certified. Our contract with Hamilton County actually went through July 1st, but we were kind of at a point where we had our certifications and they didn't have any open permits, and we just decided to go ahead and terminate early and start that program. So as of June 1st, contractors can come to us locally to be able to get those permits and do those inspections. So good thing for Clermont County. And actually, we already had our first one come in, so pretty excited about it.
They need to be permitted or have inspections if they what?
So medical gas, you're talking, you got to think of any type of dentist office, healthcare facility, hospital. It could be delivering oxygen, nitrous oxide. I won't remember all the gases that they can deliver medically off the top of my head, but any of those type of facilities have to have those systems inspected. It's like a whole complete different system. When you think of like plumbing, okay, medical gas is a whole complete separate.
Household.
No, commercial only.
Good, thank you.
Insurance billing. So this is something that we've been ramping up for the last year or so, but we continue to be able to provide, we can do any of the major private insurance carriers. I think a lot of times people think of public health like we only deal with like the Medicaid population, and that is simply not true. We can see anybody coming through our child, adult, or international travel immunization clinics to be able to offer them services. We are Medicaid certified, and we do Medicare also for immunizations. But we take all the major private insurance carriers. So if it's a vaccine your physician doesn't carry, particularly international travel, those are not readily available. So if you're traveling overseas, you can come and get those vaccinations from us. You do have to plan ahead. Some of those you have to be vaccinated several weeks before you leave the country. So we do ask people to try to plan ahead with that. But we can basically see anybody. This has really helped us, particularly with our back to school clinics. If parents couldn't get into their regular physician to be able to get their kids vaccinated, they were stuck paying us cash because we weren't always credentialed with all the private insurance companies. But in the last couple of years, we actually became part of a collaborative at the state level with other public health agencies, so we can offer those services. So again, we just, if people are in need of vaccinations or TB skin testing, those type of services, we encourage them to call us. Food safety training, actually stopped doing our Serve Safe training a couple years ago just because, again, we had some staffing shortages, and it's one of those things we're not required to do it. It's certainly a good thing that we do, but when we were short-staffed, we had to go down to, the inspections and things that we needed to do. So we have since started doing that again. The food code actually requires that a level 1, which is considered a person in charge, it's a 3-hour training. You have to have a person on site all times that business is open. You have to have somebody who's certified as a person in charge with that. We offer that course every other month. We've done over 40 workers in 2016. We have done a lot in previous years with that. This is a course that's most people are kind of meeting that requirement unless they're new into the food service industry. Serve Safe, we just started back up this year. That is what's considered a level 2 training. It is a 16-hour course. We've done 125 workers this year in 2016. We're also a proctor site, so people can go online and take the course, but you have to go to an official proctor site to take the exam. And so people can come to us also and we'll proctor the exam for them. So another good thing that we've started back up with our Serve Safe courses. Low-cost rabies vaccines, also, again, something when we were short-staffed, budget cuts, we had to kind of stop for a few years in there. We've started doing it again. In January, we started offering the clinics again. We actually vaccinated 99 dogs, cats and dogs. But this is something that our environmental health staff typically run in conjunction with a local vet who donates their time and services. We do pay for the vaccine, and we typically pay for some of their staff to be there, but the vet will donate their time to be able to do it. We try to offer them in various locations throughout the county, but we investigate typically a little over 300 animal bites every year, their environmental health staff, who, the concern there is rabies. And so if they bite somebody, that animal has to be quarantined for typically 10 days. And then we try to follow back up and make sure they get them vaccinated with it. And then we test anywhere, that should be 20 to 30, not 130, that was my typo. 20 to 30 specimens get shipped to the state lab every year. And that can be, cats and dogs that maybe died during the quarantine period. It may also be bats or other animals that had contact, were in a home, something occurred where we think there may be some type of exposure, and those get shipped up to the state lab and examined. Septic rehab program. So, Bob, I think you'd asked me to come and talk a little bit about septic rehab and everything that we have done with it over the years. So I have some data here. I don't have data back to the beginning of time because it was before my time, and it's before any of my staff's time at this point. So we do have data since 1996. We have done 173 residential homes have been assisted with the program. Since 2006, you're looking at about $1.3 million in repairs have been financed. And then we actually have an additional $450,000 budgeted for this year.
This is a big year then.
It's a really big year because we have dual funding sources this year, which we normally don't have. We are actually hoping to assist 25 properties this year. This could be our record year. In 1997, we did 23 properties. That was our most recent, largest year that we did. The funding is a combination, particularly for this year, of community development block grant funds, and then we have $300,000 this year in EPA water pollution control loan funds. We don't always have access to those, but there was a set aside specifically for public health that was given to deal with septic systems. There's some difference with the funding sources, so we try to combine those to make the funding go as far as possible. So water pollution control loan funds do not allow us to connect to public sewers with it. You have to do on-site septic system repairs or installations with it. They also have a different breakdown category, so sometimes people have to come up with, it's like a 50, 85, or 100% funding. What we can do is for people that may hit that 50%, I don't think we can do it for them, but the people who hit the 85% funding for water pollution control loan, they're still going to struggle to come up with that 15%. A lot of times we can use CDBG funding to complement that. So we try to, mix and match as best as we can to make the money go as far as we possibly can with it. Obviously, the recipients are typically low income. We deal with a lot of elderly individuals. And then families. I think, particularly in the last couple years, our biggest group that we're starting to see is that kind of working poor, where, you know, mom and dad have full-time jobs and they're doing the best that they possibly can, but there's no additional money in the budget. So when your septic system goes and you've got a $15,000 repair or, you know, a $20,000 new installation system, they don't have the funding to be able to come up with that.
Well, yeah, and that low income, is that comparable like Medicaid, where it's 1.35 times the poverty level?
It's the CDBG requirements for low income, which I think is 200% of the poverty level.
200?
So it actually goes up.
Okay.
I mean, we occasionally run across people who don't income qualify, you know, that will have to kind of kick out on it.
Well, they have to be a homeowner, so I guess it would
They have to be
I mean,
yes.
Obviously, you're not at poverty level owning a home quite often.
They have to
Could
be, yes, you could be, depending on,
Sure.
you know, how you got the property. What you'll have is maybe somebody who bought the property when they had a really nice stable job and for whatever reason, downsizing, lost that job.
But
You know,
you think it's about 200%?
I believe that's the CDBG.
Okay.
I don't know if is it, thank you. That's the CDBG is the 200% of the poverty level.
Are you still having difficulty finding contractors?
It's a tough year for contractors. We're doing okay. We're not always getting 3 bids per job with it, which we don't necessarily have. We ask for 3. We try to get them. At some point, if you don't get them, we can move forward. But it's a tough year, and contractors are cherry picking. So I have some pictures of actual septic rehab jobs that we've done over the years. Going out and installing a septic system on a vacant piece of property when it's brand new construction is 100 times easier than going into one of these properties where 3/4 of the yard is filled with sewage, and you've got to go find a place to do it. So, you know, we've got great contractors in this county, but I don't blame them at this point. A lot of them are booked up for the summer already because we are starting to see building, you know, it is up a little bit. So they're kind of cherry picking the jobs with it. So far we're doing okay. I think we have 1 or 2 properties we're a little worried about on getting bids for them. They're difficult jobs. Nobody wants them. You know, they're just tough ones. So we're going to have to see what we can do with them. So as far as the process goes for how this happens, so my inspectors are out all year long doing operation permit inspections. So in the state of Ohio, if you have a septic system, by law, you're required to have an operation permit to operate that septic system. So they are out and about. They do approximately about 6,000 to 8,000 inspections a year. Everybody's kind of on this rotating cycle. We work through the townships when we do it. But anytime that they're seeing failures out there, they're telling people about the septic rehab program. And, you know, if they think that they can income qualify, or even if they think they don't, they'll make them aware of it throughout the year. Anytime where we're starting to do mailings for any of our funding, we send it out to people that we know are failing. We sent postcards out this year to every single failure we had in our system to be able to let them aware that, hey, there is funding out there to help you. They do have to step forward and take advantage of it. So we actually have an assessment process. So I have 2 to 3 staff people that actually go out and they rank the properties based on the failures. So that first picture you're going to see up there, obviously all of that standing water, that is actually all raw sewage surfacing to the surface of the ground on it. They're going to rank it as far as how bad is the system failing. We also take into consideration the number of times people have applied for funding. They get additional points. So if you applied last year, I mean, we end up with a list. Bob can tell you on septic rehab, we end up with a list this long and we get to this many properties every year. So people that reapply, each year you get points added so they try to move you a little further up in the list. And then it's also based on level of poverty. So somebody who is extremely poor may rank a few points higher than those others. The Septic Rehabilitation Committee basically approves our work plan of how we say we're going to carry out the program, and then we provide them with a list of ranked properties annually that they go through and basically verify our entire list, and then we just work down the list as funding becomes available. Sometimes properties will get kicked out. If they owe county taxes and they can't pay those, we can't fund them. To be able to do that, there's several things we can overlook, but there are certain things we can't overlook. So we occasionally will have people who get eliminated from the program kind of along the way, and we just continue to move down that list with the funding we have available. So Again, these are a couple nice pictures. The first picture up there, you can see, again, all that standing water is raw sewage surfacing up through the ground with their pool, their lovely pool there, that they're swimming next to. The one on the right with all of the kids' toys, I mean, bikes, I mean, it's sitting in a pool of raw sewage. So obviously major public health concerns that we have for these properties that are out there. This is another one. Again, it's kind of right off their deck. They've got their trampoline there. Again, we've got kids out playing. The one on the right is right next to kind of like a driveway. You can kind of see across the street where there's a little kid's tricycle there. Again, concerns about them being out and playing around this. This one, they're sharing with a neighbor there. So that fence line is the neighbor's property. And unfortunately, you know, towards us is the property that has the failing system, but you can see it running onto the neighbor's property, and there's a huge swath of grass there that they can't even mow in their yard because the sewage is coming onto their property. This one, kind of interesting, the sewage is actually coming right up, and that is their, like a basement door. Coming out of it, again, as you kind of pan out, they're all three the same pictures of the same property, but we have the kids' basketballs in it, you know. We've got bikes, that whole area kind of down on the right where all the high grass is again, that's all sewage that's surfacing there. This is a really interesting one. So if you kind of want to see what happens, we lucked out with these pictures somehow and got aerial pictures of before, during, and after. So you see all the dead grass at the back of their property there. That is all sewage. There's sewage surfacing. So you have, you know, a good, pretty much the entire backyard really can't be used at this point. And it's very difficult because we can't put a system in where it's already failing on top of it. So this is our before picture. You know, this is during. Putting in septic systems is not pretty. So I always kind of joke in public health that our job is not to make things look pretty per se. It's great when we can, but our concern is more about the public health issues that are out there. So this is a mound system that, you know, is being put in along the side of that property. So unfortunately you end up, you know, with your yard tore up quite a bit. However, it ends up pretty in the end. And you can see their their backyard is once again usable space for them that they are able to use. So any questions on the septic rehab?
Typical cost of that is around how much? 25, 30,000?
It depends on the system. I really hesitate to quote cost. You're in the ballpark on it, depending on what type of a system it is. Keeping in mind, not all septic rehab are new systems. So sometimes there's enough there that we can repair the existing system that they may have. So those are much less expensive jobs. They may be $3,000, $4,000, up to maybe $10,000 to repair an existing system if they have enough there that we can work with it. If they don't, like in this circumstances, yeah, you're probably looking in the 20s to be able to completely replace a system like that.
I know, of course, it's based upon soil type.
Soil type, the other thing we have to look at is the number of bedrooms that are in the home. So obviously a 2-bedroom home is going to have a much smaller system than a 5-bedroom home. We don't necessarily look at occupants, it's based on number of bedrooms.
Well, and also too, you're using experimental
Actually, most of the systems we use are not considered experimental anymore.
anymore.
No, the state has approved all of those. They are used throughout the state of Ohio. They
So
are
it's
not.
just mound system.
No.
People think you just put in a mound system.
No, I will tell you, probably when you get more in the southern part of the county, a lot of them are going to be mound systems. And it's, again, it has to do with the soil type. We have a seasonally high water table. So there are certain times of the year the water table comes up. You have to have enough soil there to be able to treat the sewage before it hits that water table. So that's why a lot of times we are looking at mound systems to be able to build that up to get that space in there to be able to do that. But we still install leach line systems depending on where you're at, your soil type, number of bedrooms, how much property you have. There are other options out there. We occasionally will still do like an experimental. Some of the drip irrigation systems are still experimental. They're really expensive. If we can try to do something else, we normally wouldn't recommend those, depending on
We have a couple of those.
what it is. Sometimes there's no choice. Drip irrigation can work very well, particularly when you have a wooded lot. So if there's no place for you to go put a mound in like that, or put a leach septic system in, drip irrigation can work
Drip
in those type
irrigation
of.
is the kind of a chemical process that.
It's
perhaps-
literally much smaller lines that are literally dripping very small quantities of water throughout the entire system versus a larger dose.
Okay.
that you would see typically going through a septic system or a mound. But they're very expensive to install. So
This particular example, they turned off the old system and went into the new system?
yeah, they actually abandoned, I don't know if you can see where the old tanks were. It looks like there was something kind of off that back corner there, was probably their old tanks. But likely with a failure that big, they, and depending on the age of the tanks, they're normally going to have to be replaced. Septic systems were not meant to last the lifetime of a home. And I think that's a big misconception on it. They may, I'm not saying they won't, they may. And if you maintain them and take care of them, they may last a really long time. But your average expectancy would be about 30 years on a system, which is typically why on a new construction, they have to have an existing area and they have to have a replacement area. So that's part of a concern when we have these really small lots. If they haven't been built on yet, it's a struggle because you have to have enough area for the system you're going to install now, and then you have to have a completely separate area for a replacement system on that piece of property.
Now, on a septic tank, you recommend every 2 years to having it pumped out?
2 to 3, again, number of people in the household. Sometimes there you want to take in occupants, not necessarily bedrooms. Like, how many people do you have living in the household? How often are you doing it? If you have a good septic contractor, when they come out and pump it, they'll give you a good idea too of like, was it really full with solids, or how was it with it? But there is maintenance on these systems. Particularly, a lot of the systems have motorized components to them. That motor will go out. You have to be aware of it. Most of the newer systems have an alarm on them now, but you have to replace that motor. There's upkeep and maintenance on it. The other thing is the discharging systems with it. A lot of people always ask us, like, why can't we just put in, subsurface sand filters like we did years ago and just discharge them all? And they think it was us that did that. It was not. It was actually EPA. In order to have a discharging system now, you have to have a NPDES permit, so a National Pollutant Discharge Elimination System. But we call them a NPDES permit, just like you would if you built a big giant sewer plant. You have to have a NPDES permit. So each individual home would have to have a NPDES permit. They have to test that. They have to sample it. The old subsurface, they didn't meet the water quality standards to be able to do that. We can still install discharging systems if there are no other viable options. And then those people are stuck buying a NPDES permit. Permit costs about $200 a year. They have to pay for the sampling of it and maintain it and do that. So just with the maintenance on it, we try to not do that whenever we can, but some of the lots we have, there's just no other option. All right, my last thing, move measured mile. So we actually wrapped up and just got our numbers on Friday, so I was planning on coming today anyway, so you're gonna get move measured mile today too. We ran move and measured mile from April 18th through June 12th. It was our 26th year. We had 431 employees sign up, but only 303 completed. And I want to work on that for next year to figure out what we can do to make sure we get people who sign up to complete through the process. So as a total, we moved approximately 34,003 miles this year. For reference, the equator, around the equator, is 24,901 miles. We moved an average of 112 miles per person, which is actually an increase of 22 miles per person on average over last year. Our highest mover was Tim Morrow with the jail at 734 miles that he moved, so I had to Google some distances and figure out that's like walking literally from here to Mobile, Alabama. So the jail also won the plaque and bragging rights a year again. They won last year, but they on average moved 319.33 miles per person this year. So they will get their plaque and bragging rights for next year also. We did the drawings. One of my staff members will be sending out a countywide email with we have 40-some t-shirt drawing winners, and then we have a person who won a Fitbit and then a My Hydrate water bottle. So that'll be coming out in email, but I wanted to go ahead and give you the results of move and measured mile.
112 miles is pretty significant for less than 2 months. I mean, that's pretty good.
It's a lot. It's a lot. So a lot of times what you'll see is you have those really high movers like Tim who boost your numbers up. So,
Tim and Judy.
So, but yeah, it's a lot. It's a good thing. So we have a lot of people always want to know every year, when are we starting to do it. And like I said, it's our 26th year of being able to do it. So wanted to provide you with those results. That is all I have. Unless you have any other questions.
Thank you.
Great
Thank
job.
you.
Thank you.
Sorry.
All right,
Was
item number 1 on our agenda, facilities.
Item number 1 is a recommendation of Mr. Grabowski with my concurrence to acknowledge the issuance of addendum number 1 and addendum number 2 to specifications for the construction of the Domestic Relations Clerk of Courts building on 6/22/16 and 6/23/16 respectively, which one extends the date for the receipt of bids, therefore from Thursday, June 30th until 2 p.m. local time on Thursday, July 14th, Office of Board of County Commissioners, and 2 extends the deadline date for inquiries, questions relative thereto from the June 23rd until Thursday, July 7th, which is 1 week prior to the revised bid opening date. This notice is also posted on the Clermont County's website. Quick reference, we held the pre-site visit, and we were requested that we extend the due dates for the bids based on that visitation, which is good. We had a number of companies come. We also had over 23 companies ask for the bid packages, which was nice. What we did not account for, and I was unaware of, if the board remembers, we're looking at the pre-engineered construction approach. And according to the institutes that represent those firms, they actually shut down the week of July 4th. It's just one of those things that industry does for the whole week. So they asked, because of that, they wouldn't have time to appropriately get bids back to us. So I opted to extend those deadline dates.
Steve, the estimated price, we budgeted like $1 million something.
1.1 is the current estimated engineer's estimate.
So what we're doing is it's already been issued. We're just acknowledging it.
Yes, sir.
Is there a motion then to acknowledge addendum number 1 and addendum number 2 to the reference project as recommended?
I'll make the motion.
Second?
Mr. Ubel?
Yes.
Mr. Humphrey?
Aye.
Mr. Proud?
Yay. Hey, Doug, item 2, please. Morning.
Item number 2 is a recommendation of Pat Munger, the county engineer, concurrence of Steve Rabel, the county administrator, to award the bid for project number RS-0416 relative to the 2016 road resurfacing program phase 1, located in various townships pursuant to specifications to Barrett Paving Materials out of Middletown, Ohio, for the lowest and best bid received on June 2nd in the amount of $830,125.36, and to execute the contract relative thereto pursuant to and in compliance with the terms and conditions set forth therein, and the award of bid therefore, and contingent upon the issuance and receipt of required purchase order.
Is there a motion then to make the award of bid for the reference project and execute the contract with the contingency as recommended?
So moved.
I'll second the motion.
Mr. Humphrey?
Aye.
Mr. Ubel?
Yes.
Mr. Proud?
Yay. 3, please.
Number 3 is recommendation of Pat Munger, county engineer, concurrence of Steve Rabel, the county administrator, to approve the request to advertise for bids for project number RS-0716 relative to the 2016 road resurfacing program phase 2, located in various townships pursuant to the specifications therefore, and in concert with the resolution number 46-16 ratified by the Board of County Commissioners on April 20th, 2016, and as it relates to the authorization to submit applications for financial assistance for infrastructure improvements to the Ohio Public Works Commission, and to authorize the clerk of the board to place a legal notice in newspaper of general circulation on June 30th, with bids to be received until 2 p.m. local time on Thursday, July 14th, in the office of the Board of County Commissioners, where they will be publicly opened and read aloud shortly thereafter. This notice is also posted on the Clermont County's internet site.
Is there a motion then to approve the request to advertise for bids for the reference project and also to place the legal notice in newspaper as recommended?
So moved.
Second?
Mr. Ubel?
Yes.
Mr. Humphrey?
Aye.
Mr. Proud?
Yay. Item 4, please.
Number 4 is recommendation of Pat Munger, county engineer, concurrence of Steve Rabel, the county administrator, to approve the request to advertise for bids for project number RS-0816 relative to the 2016 road resurfacing program phase 3, located in various townships pursuant to the specifications therefore, and in concert with resolution number 46-16 ratified by the Board of County Commissioners on April 20th, 2016, in and as it relates to the authorization to submit applications for financial assistance for infrastructure improvements to the Ohio Public Works Commission, and to authorize the clerk of the board to place a legal notice in the newspaper of general circulation on June 30th, with bids to be received until 2 p.m. local time on Thursday, July 14th, in the office of the Board of County Commissioners, where they would be publicly opened and read aloud shortly thereafter. This notice is also posted on the Clermont County's internet site.
How many phases are there?
3.
Just 3, okay.
We broke them up due to the funding of them, and also to kind of spread them out a little bit, just to.
Last year we did one, right, which caused us to kind of be delayed till end of the season, right?
Yeah, we've done that several years. This year, it's not because of other county or other townships and stuff. This year, it's because of the funding that we have. The reason they're broken up into different phases.
Is there a motion then to approve the request to advertise for bids for the project and to place a legal notice in the newspaper as recommended?
So moved.
I'll second the motion.
Mr. Humphrey.
Aye.
Mr. Ubel.
Yes.
Mr. Proud.
Yay. And 5, please.
Number 5 is a recommendation of Pat Munger, the county engineer, concurrence of Steve Raybolt, county administrator, to approve the request to advertise for bids for project number OH2815 relative to the Frank Willis Memorial Road landslide stabilization project located in Ohio Township, pursuant to the plans and specifications and in concert with the resolution number 46-16, ratified by the Board of County Commissioners on April 20th, 2016, in and as it relates to the authorization to submit application for financial assistance for infrastructure improvements to the Ohio Public Works Commission, and to authorize the clerk of the board to place a legal notice in the newspaper of general circulation on June 30th, with bids to receive until 2 p.m. local time on Thursday, July 14th, 2016, in the office of the Board of County Commissioners, where they will be publicly opened and read aloud shortly thereafter. This notice is also posted on the Clermont County's internet site.
Is there a motion then to approve the request to advertise for bids for the Frank Willis Memorial Road Lane Stabilization Project and to place that legal notice in the newspaper as recommended?
So moved.
Second.
Mr. Ubel. Mr. Humphrey.
Aye.
Mr. Proud.
Yay. And 6, please.
Number 6 is a recommendation of Pat Munger, county engineer, with concurrence of Steve Raybolt, county administrator, to execute record plat number 629-2967 for the following subdivision located within Miami Township, and further to execute the combined performance and maintenance bond as well as performance bond for sidewalks as surety for same relative to the construction of the Pine Bluff subdivision, section 1, block B in Miami Township. Performance bond of $28,000 and a maintenance bond of $10,000, $32,400 performance bond for sidewalks, and this is for Hollybrook Lane and Vista Run Court.
Is there a motion then to execute the reference record plat, combination bond, and the performance bond for the sidewalks as recommended?
So moved.
I'll second the motion.
Mr. Humphrey.
Aye.
Mr. Ubel.
Yes.
Mr. Proud.
Hey, well, you want the whole agenda, don't you?
No, I don't want it.
You got it.
Item 7, please.
Item number 7 is a recommendation of Steve Raybolt, county administrator, to acknowledge the receipt of notifications from Pat Munger, the county engineer, on June 6th, June 10th, and June 24th of his determination to close and or extend the closure of the following roads to through traffic, with the understanding that all advanced warning and detour signs will be erected and maintained accordingly, pursuant to and compliance with section 5543.17 of the Ohio Revised Code. The first one is Woodville Pike, 100 feet west of Bulldog Boulevard, for the first of 2 bridge replacements, and upon completion thereof, 200 feet west of Bulldog Boulevard for the second bridge replacement located in Miami Township. These will be beginning on Monday, May 2nd through Friday, June 3rd, and extended to June 10th as depicted on the Woodville Pike detour map. The second is Taylor Pike, south of 6624 Taylor Pike, located in Wayne Township, beginning Tuesday, May 17th through Friday, June 10th, and extended to Wednesday, June 15th for the Taylor Pike Bridge Replacement Project. And this is for Taylor Pike Bridge number C121-3.79. The third is for the Pond Run Road, beginning at 2855 Pond Run Road for the first of 12 culvert replacements upon completion thereof. Northeast after that, and located in Pierce Township. And these are beginning on Tuesday, July 5th through Friday, July 29th, as depicted on the Pond Run Road culvert detours map. And the last is on Bethel New Richmond Road between 1348 and 1356 Bethel New Richmond Road for the first of 8 culvert replacements. And going east after that, located in Monroe Township and Ohio Townships, beginning Wednesday, June 29th through Friday, July 15th, between the hours of 7 a.m. and 5 p.m. as depicted on the Bethel New Richmond Road culvert detour map.
Is there a motion then to acknowledge the receipt from our county engineer about the road closures or the extension of the closures as recommended?
So moved.
Second?
Mr. Yubel?
Yes.
Mr. Humphrey?
Aye.
Mr. Proud?
Yay.
Thank you.
Hey, we've got an animal claim. You want to do that one? No. Okay. Thanks, Doug. Item 8, please.
Item 8 is a recommendation of Diane Gray, Chief Animal Control Officer, Clermont County Animal Shelter, with my concurrence to authorize payment in the amount of $40 for the animal claim filed by Frank Sharp, Felicity, Ohio, for the loss of one lop rabbit on property situated within Franklin Township on or about 5/10/2012, pursuant to Section 955.35 of the Ohio Revised Code, and further authorize the county auditor to issue reference payment therefore from the Dog and Kennel Fund.
Is there a motion then to authorize the payment and authorize the auditor to make that payment as recommended?
So moved.
I'll second the motion.
Mr. Humphrey?
Aye.
Mr. Yubel?
Yes.
Mr. Proud?
Yay. Training and travel, 9, please.
We have the Common Pleas Clerk of Courts, Tammy Higgy and Nicole Haight, 1 day, Cincinnati, Ohio, Fred Pryor seminars, making the transition from staff to supervisor, not to exceed $198. Alice Frick, Tiffany McElvoy, and Elizabeth Burrows, 2 days, Columbus, Ohio, the Supreme Court of Ohio Judicial College. Total expenses not to exceed $601.59. County Auditor's Office, Jennifer Hartley, 3 days, Columbus, Ohio, for the Ohio Government Finance Officers Association 29th Annual Conference, not to exceed $1,029.08. County Recorder, Dr. Treon, 3 days, Cleveland, Ohio, for the Ohio State Coroner Association 71st Annual Educational Conference, estimated not to exceed $928.40. Department of Job and Family Services, Jennifer Binder, 1 day, Philadelphia, Pennsylvania, transporting of a child, estimated not to exceed $2,010. And Department of Public Safety Services, Daniel Young and Shauna Holland, 3 days, Cincinnati, Ohio, for Cincinnati Communications Emergency Dispatch 13th Certification Course, not to exceed $730.
Is there a motion then to approve the training and travel requests as recommended?
So moved.
Second?
Mr. Yubel?
Yes.
Mr. Humphrey?
Aye.
Mr. Proud?
Yay. Personnel actions, 10, please.
Department of Job and Family Services, Joyce Kraus, Wraparound Coordinator, transfer to new position effective 7/1. Water Resources Department, James Mathis, WRD Maintenance Supervisor, promotion effective 7/5/16. Brenda Barrett, WRD Lab Technician, probation, end of probation effective 6/28. Thomas Bowles, WRD Maintenance Technician 1, termination resignation effective 6/24. Department of Public Safety Services, Lori Schluter, Fiscal Support Coordinator, a salary change, temporary job change effective 6/20. Board of County Commissioners, Ralph Justice, Program Administrator, retirement effective 9/30. And Board of County Commissioners, Office of Management and Budget, Jessica Hornsby, Fiscal Support Coordinator, salary change, temporary job change effective 6/6.
Is there a motion then to approve the personnel action forms as recommended?
So moved.
I'll second the motion.
Mr. Humphrey?
Aye.
Mr. Yubel?
Yes.
Mr. Proud?
Yay. Any add-ons?
No, sir.
All right, we'll take a 5-minute recess for our minutes to be prepared.
Where it was.
I'll let the record show the board came out of its recess and back into our regular session. And we have the minutes here, and I think there was one little addition.
One little correction, yeah.
Commissioner Humphrey had suggested. And so when you're all ready, entertain a motion to approve the minutes with the inclusion of Mr. Morrow's accomplishment.
So moved.
I'll second the motion.
Mr. Humphrey?
Aye.
Mr. Yubel?
Yes.
Mr. Proud?
Yay. No other business? Is there a motion to adjourn?
I'll make the motion to adjourn.
Second.
Mr. Yubel?
Yes.
Humphrey?
Aye.
Mr. Proud?
Yay. Thank you all. God bless.